Hey everyone, it's Aaron. Welcome back to my channel. So today I wanted to talk about surgery and some of the surgery that I just recently had and kind of how that affects me and things that I do to sort of get through it. So I've talked about this before. I have had 25 surgeries related to my rare genetic metabolic bone disease called hypophosphatasia. So I've had nasal reconstruction. I've had 4 shoulder surgeries. I've had 3 surgeries on my thumbs. Had 3 surgeries on my elbows. I've had 2 surgeries on my radial nerves, which is also my arm. I have had knee arthroscopy. 2 weeks ago, I had an MCL reconstruction where they had to go in and put a graft in to reconstruct my MCL. And also, they had to do a hamstring tendon release because my hamstrings were very inflamed and just frayed. That was a bonus. We didn't know that going in. He didn't know that my hamstrings were that bad until he got in there and actually had to do surgery on that. And then some of the bigger surgeries I've had is I've had my hips totally replaced. So when I was 20 years old, I found out my hips were going bad when I was 18, and then at 20 years old, I had my hips totally replaced. When I was 24, I had to have my hips redone. One of my hip replacements failed; it shifted out of place, so the implants had come loose, and I had to go back in and take the prosthetic out, put new ones in. And I've had a core decompression on my hip. That was before I had the hip replacements. That's where they go in and drill into the hip bone to try to help promote blood flow. So I've had a lot. There's a couple more surgeries that I've had. That's just some of the highlights. But surgery has been a really big part of my life and my disease journey. You know, 4 surgeries that I talked about, there's 4 of them that I've had this year. This year I had what's called radial tunnel release on both of my arms, where they go in through the forearm and release the radial nerve because my radial nerves were compressed. And then I had a knee arthroscopy in August, and then 2 weeks ago I had the MCL reconstruction. Last year I had the 3 elbow surgeries. The year before that I had the 3 hand surgeries, like the thumbs. So it's been a huge part of my life, surgery. To me, it it seems like unfortunately a common occurrence, a common theme with what I'm going through and the surgeries that I have to have. My ultra rare genetic disease definitely contributes to that. A lot of this stuff happened a lot of these surgeries happened pre-diagnosis. So like the hip replacements, that stuff happened pre-diagnosis. The nasal reconstruction, um, 3 of the 4 shoulder surgeries happened pre-diagnosis. So those happened several years before I was diagnosed, and we didn't know what was going on. We were in the period of not knowing exactly why my hips went bad so young. I mean, I did have avascular necrosis, but there were some questions around that and how that occurred. And so it's been a huge part of my life and my disease journey, and it's something that I don't love, but I've come to terms with. Come to terms with that there are things about my body that need surgical repair that oftentimes a lot of people don't need these types of surgeries, but unfortunately I do. So, with that, if you've ever had surgery, you know that there's a lot that comes with it. Surgery is mentally and physically and emotionally draining. It is something that can really get you down. And I try to put myself in a place where, knowing that surgery is something that is to help me get better. It's something that needs to be done, that's necessary so that I can not have any more pain or get function back somewhere, or sometimes both of those. But surgery is something it's a treatment, it's a necessary part of living with this disease. And it's to make me better. And I try to just remember that going through the recovery and the kind of downtime and the pain and oftentimes for me, physical therapy, the rehabilitation part of it, that really sucks. It's part of the journey and part of getting me better. And like right now, by the end of 2 weeks ago, I had my MCL completely reconstructed, as I said earlier. And it's obviously not the biggest surgery I've had, but I would say it's kind of up there just because of the intensity of it. I mean, when they do an MCL reconstruction, they cut your knee open on the outside of the knee. I have two incisions, and they drill literally through your femur out the other side of your leg. I have puncture holes on the other side of my leg where they had to drill through the femur and the tibia, and then they anchor in the tendon graft in there, suture it in, and there are sutures that go through the whole thing, and then adding the hamstring tendon release really just made this a tough surgery. Recovery is also long. I am currently in a hinged knee brace that covers thigh to ankle. It is currently locked straight. I'm not allowed to bend it in or out of the brace, except for when I'm in physical therapy. And then, but the max amount that I can bend it is about 60 degrees, so they have that locked as well. So when I'm not in physical therapy or anything like that, my leg is straight. I'm on crutches, and I'm not allowed to put my entire weight on it. I'm supposed to use crutches every time I get up. And I'll be honest with you, I've not followed all of the rules with that. I have 9-month-old twin girls and a 5-year-old son, and our house gets chaotic sometimes, and sometimes I'm not even thinking about it. I just hop up and limp and go do something, and then realize that I've done it. So there's that. But it's a long process. It's about 6 to 8 weeks in a brace, and then physical therapy and crutches and all of that. So it's kind of up there in terms of recovery. But surgery is difficult, and it's mentally, emotionally, physically training. But again, it's necessary. So there are things though that I do and things that I know kind of about myself that I need to do to kind of get through it. So I know for me that I will go through. I get very anxious about the surgery. Even having so many surgeries, I get very anxious about it, and so I know that I need to kind of focus on that. I need to take care of that, and then I also know, and I've not shared this before, but after surgery, I don't know if it's kind of the surgery and all the general anesthesia and the pain meds and other meds that I have to be on post surgery, post op. I go through a period, it usually lasts a few days, of just anxiety and depression. And I deal with anxiety and depression in general. I have so many health issues and so much that's happened in my life that I deal with anxiety and depression a lot. So I'm on medication for that. But after surgery, whatever it is, whatever it is that triggers kind of all of that, it hits me pretty hard for a few days. So I know that I'm going to need to potentially up my antidepressant for a few days. And I talked with my physicians about all of that. And so I kind of recently just got out of that period of kind of extra depression and anxiety that affected me. And I knew what it was. I knew it was coming. And I knew that I needed to kind of up my meds to kind of get through it. So that's something that I deal with, and it's not fun. I just think that it's kind of a combination of all the medication, the general anesthesia, the pain, and everything. I think just kind of triggers a period of depression and anxiety. But thankfully, I've been able to identify that and notice it and take care of it. And then I know that I will need to have rehab, and there will be a period of sort of not being able to do what I want to do, of recovery and all of that. So things that I do is I make sure that I'm set up for that, make sure that I've got a plan in place, especially for this surgery, knowing that I was going to be on crutches and not able to drive for a few weeks, and I had to go to PT and stuff like that. So kind of had to make provisions for that, and we kind of adjusted our schedule. I had to adjust my schedule and my wife's schedule, and to make it work. So surgery for a lot of people can bring on a lot of that. So if you're having surgery, especially if you've never had surgery before, it can be very, frankly, scary. It can be very scary. If you've never had general anesthesia, it can freak you out. That's just the truth. General anesthesia, obviously they give you some meds before they roll you back, and then you're sedated, and it's like all you remember is going to sleep, and then you wake up and you have no clue how long it's been. It could have been 20 minutes, it could have been 5 hours. You don't have a clue. It just kind of it seems to go really fast, and all of a sudden you're awake and done. So it can kind of freak you out. And I would say so. My one of my little ones had to have some general anesthesia for a test recently, and he was freaked out. It scared him. I mean, it was tough. So it can be that way for teenagers and adults the first time you ever have that type of thing. So knowing that, I mean that alone brings anxiety and about the surgery. And then knowing that, if you've never had surgery before, you don't know what the recovery is, you don't know what the pain's going to be like. So there's so much to it that adds an extra layer of everything that we deal with as chronic illness patients. So myself, and I know a lot of other patients I've talked to, we deal with these things. Like I said, I deal with depression and anxiety outside of all of this. Related, a lot of it's related to my chronic illness. Probably all of it's related to my chronic illnesses and everything that I've kind of been through. So it can just exacerbate all of that. So it adds that extra layer of something that we kind of have to deal with and take care of. And so it's really important to be on top of that. I like to say my suggestions is if you know that you have a lot of anxiety and depression and you're gonna have surgery, you may want to talk to your physician about that. There's things that they can kind of do to help you get through it. So I try to just remind myself that this is for good. This is for me to make me better. This is to get me back to what I want to do, what I love to do, and to give me some function back. And know that it's going to be hard for a few months after potentially, but it is going to be for the better. So this MCL reconstruction has been tough. I've had some hard surgeries. This is definitely one of them, and I just wanted to make a video to kind of talk about it, talk through it, give you my kind of fears and anxiety. I've had all of these surgeries, and even for this MCL reconstruction, I still had anxiety about it, depression about it, knowing that I was going to have another surgery and more medical bills and more pain and recovery, and it gets harder and harder every time for in terms of the recovery for me. So knowing all of that, I mean, it really brings on this kind of fear and anxiety that I still face every time I have surgery. And it's not, it gets easier in a way, but it doesn't get easier. And I also don't want people to, like, I have so many surgeries. I don't want it to be like, oh, Aaron's just having no surgery. Aaron, this is what Aaron does. And it does feel like this is what I do. This is, part of what I do all the time. I've had 4 this year. But I don't want people to lose empathy for me, just not that, because sometimes to be totally honest, sometimes I need that. Sometimes I just need a little bit of a hug, or just a hey, it's gonna be okay, or hey, I'm thinking about you, to kind of help get me through. And that's just the honest truth. I don't really I don't look for pity or sympathy all the time. I deal with a lot of stuff, and I do it with a smile on my face. And most of the time, most people don't know that I'm going through and what I'm dealing with internally. I often will compress that when I'm in public. I do share my story so people can see it if they would like, and I'm very open and honest with you all about what I go through. But outside of that, a lot of people don't know that I'm dealing with what I deal with until I tell them, and I think that's part of what a lot of patients with chronic illness do. I mean, we live with these diseases that aren't visible. And so oftentimes we kind of just put on a happy face and go about our day, and that's part of it. And that's the same thing with surgery. You just kind of put on your happy face and just get through it. So again, if you're having surgery and you have questions, please let me know. I just wanted to share a little video just talking about that, talking about kind of what I experience and what I go through and how I adjust for that and handle it. If you have any questions about any kind of surgery, let me know. I'd be happy to answer any questions, any fears that you may have. But just remember that surgery is something that is necessary to make you better, to give you function, potentially give you function back, and to get you in a better place, to get your disease in a better place if that's what it's treating, or to fix a broken bone or something that's broken. Surgery is a hard thing, but a good thing that can really get us to a point where we're feeling a lot better and get us that mobility and function back. So just remember that as you go into it, and just make a plan, make sure that you're well prepared, and that if you deal with kind of depression and anxiety and the emotional stuff, to talk with your physician beforehand, but probably your primary care. If you see a psychologist, definitely talk to them to get some things in place for you, because it can be mentally and emotionally challenging after surgery, and you may have end up with a little more anxiety, depression. So you just want to make sure that you've accounted for that, like I have to. So again, thank you for listening. If you ever have any questions, please let me know. I'm always here to help.